So where are things going to go in the next 10, 15 years? So I would say that overall, the ability of people to predict what's going to happen is pretty poor overall. So when I think of the last 10 to 15 years, thinking of SARS and H1N1, problems on a global scale, climate change. I mean, like the changes have been significant and the events significant and would not necessarily have been predictable, frankly.
So the future of public health, I actually think that we need to recharacterize health from the humanist point of view to what we call now post-humanist. I also think that we need to return to some of the basics and make sure that we are absolutely, in a new context, being able to do health protection, immunization, take on again those areas where people are quite resistant to public health's very, very, well understood and well characterized solutions for problems. But it is a new world, so that has to be, again, a new way, a new strategy. We also have to communicate perhaps differently around how problems are framed, around the kinds of solutions. We need to really help both the policymakers, but all the public as well, think about new possibilities, because we've got to bust paradigms of what our economy is about, what health means, what lifestyle is inferred, how we live in our cities.
So I decided to look at what the 10 great public health achievements of the 21st century might be. So how are we going to tackle these huge problems that we have, like climate change, like the huge crushing burden of mental illness, which is now at least 50% greater than the burden of cancer, probably twice as big as the burden of cancer in our community. Like poverty, something that is becoming more and more intense, and disparity growing, having much greater impact on health, and really one of the drivers now of chronic disease rates and illness rates in our community. We're well positioned to both deliver service and also speak out on and provide sort of the policy direction and advice that I think can create fantastic change.
I'm currently doing a thesis looking at antibiotic-resistant gonorrhea. And I think that antibiotic resistance is going to be a larger and larger issue that we're going to be having quite a bit of work to deal with in the future, of looking at how to maintain. Antibiotics have been this huge development in public health, and suddenly we're at the risk of losing them as a tool. So I think there's going to be a lot of work. One of my big interests is around clinical guidelines and looking at ways to make sure that practitioners are using antibiotics appropriately so that we can continue to use them in the future.
So in terms of the near future of public health, I think that integration across sectors is something that's really been going on for some time and only increasing at present. When the discussions of health in all policies, I think, are really moving from a theoretical place that they might have been some years ago to really taking root across sectors, whether that might be in transportation, education, or other social services. I think that that's something that we're seeing increasing, and as public health professionals need to train ourselves to speak the languages of these other specialties, and also to let others know about how health ties into their work.
So where do I see public health in the next 10 to 15 years? I don't know is the answer. And I think because public health is very much dependent on, at least the practice of public health, profession of public health, very much dependent on sort of political decisions.
Definitely starting to infiltrate the traditional healthcare system. I think people, especially governments, are now recognizing the benefit of prevention. And I think we really need to get in there and start educating people about what public health does and how we can help and prevent people from using the healthcare system. This is especially concerning when you look at how much we are spending on healthcare and how it continues to grow. I feel that if we start advocating for more investment in public health, we can actually start curbing the costs in the healthcare system.
So my hope is that public health as a a higher engagement. Some people call it a higher profile. I don't think a profile is really what I hope for. I hope for higher engagement and integration.
I think the issue is how do we leverage, the focus currently obviously is on effectiveness and efficiency, and the fact that the amount of money we're spending in the acute care system is actually gobbling up and is an opportunity cost to other things that would make a difference: education, job training, housing, environment, etc. So the focus is always on the 95%, 97% of the budget, which is going to the acute or chronic care sector. So I think a challenge for public health is to say, hey, we can make a difference here. If you could move upstream, how do you move upstream? How do you take Jeffrey Rose's graph, and while agreeing that we have to focus on the far right end of the needy population, how do we also persuade people that we have the tools to move the curve over to the left by producing a healthier population, do it in such a way that we can reduce need on the acute care system. So there has to be some return on investment there.
So I think we're going to have obviously a pressure with a continuing aging population and a lot of pressure on the healthcare budget overall, which is going to put increasing pressures on other things the government should be spending money on for the betterment of society, which from our perspective are major health determinants: housing, education, adequate income, etc. So that's a problem. So in fact, the healthcare system from a budgetary standpoint is going to become an increasing threat to the overall well-being of society. Within the healthcare budget itself, the pressures on the healthcare budget is going to put pressure on public health's budget, and the extent to which there's going to be adequate and sustained funding for public health for us to be able to do what we need to do. So that's going to be another challenge that we're going to be faced with. The third, more macro challenge that we're going to be faced with from a health perspective is, I think, the increasing changes to climate and the repercussions that's going to have on people and populations. And we're already seeing it now in terms of people wanting to migrate, because where there's pressure on environment, land and water, there's pressures on political structures and refugees and migration. So I think that those are going to be major, major challenges that public health should be in a position to help with and argue for. So the other sort of shift that's occurred politically in many countries is towards a more individualistic perspective on living. And this runs counter to a more collectivist perspective that we have in public health, that we're in this together, we are social beings, and how we design our communities and have community involvement and make democratic decisions is integral to health and well-being and decisions for the health of the public. And so it's going to be interesting to see over the next 10 to 15 years, particularly as there's budgetary pressures, particularly as we feel the effects of degradation of the environment, of migration of populations, that are we able to maintain a collectivist perspective and have healthy public policies to improve the health of the public overall, or are we going to become more selfish and individualistic? And I think our ability to work and do good in public health will be affected by whether or not the overall political climate supports us or not.
There is a lot of room for people with public health knowledge and skills to work in non-traditional public health areas. For instance, a public health trained physician who then works as the chief administrator, for example, of a small hospital, or who goes to work in a less traditional environment like a non-governmental organization, a not-for-profit organization, an organization devoted specifically to mental health or addictions, will bring in this fantastic range of knowledge and skills that you acquire in public health, and more particularly, I think, a very, very dedicated understanding of equity in health. And I think that making sure that we place ourselves in non-traditional public health roles is very, very important. We're ambassadors of public health, not just practitioners of public health. And that means that the direction for public health will depend a lot upon what our politicians have to say about the nature of our society. So when our politicians make decisions to cut back on public health related services, then we see problems happening inside our own world and our ability to get work done. And our dependency on government just can't be underestimated. And I guess I hope some of us go into politics and manage to convince other people to keep directing resources in our areas.
Donc, je débute ma carrière présentement, puis c'est vraiment un bon moment pour débuter la carrière en santé publique parce que la santé publique est en grand changement présentement. Il y a des décennies, la santé publique, c'était presque exclusivement les maladies infectieuses, les maladies transmissibles. On a élargi ensuite avec les maladies chroniques, puis on est encore en train d'élargir puis augmenter les collaborations avec les différents secteurs de la société. Donc, c'est vraiment un grand moment de changement. Donc, c'est très excitant.
I think there's always core elements to public health that will always be there. So we're still going to be working on communicable diseases and chronic diseases and maternal child issues. We'll also be working on violence issues, mental health issues. We'll be always working with vulnerable populations and trying to support them. Hopefully we'll be working a little bit in more of an integrated way. The public will have a better understanding. I think they've gotten more of an understanding as we progress about what we do, but they'll have an even better understanding of what we do and value that, and that will be resourced in a very good way in order to deliver all the services that we need to provide.
The question is, where do I see going over the next 10 years? I mean, quite honestly, 10 years ago, when I accepted the position to build the agency, I'd never anticipated we'd be where we are. Because at the time, at the federal provincial level, when ministers got together or deputy ministers got together, public health was almost never on the agenda. The only times it was maybe for an annual report, or occasionally if there's some kind of a crisis, they'd have a bit of a discussion. But we built kind of a relationship across sectors that allowed us to deal with H1 in a way that no other country could. And actually, for the first time in history, we actually changed the course of a pandemic. And that was the culmination of the effort of a whole lot of people to get to that point, and to the point then when actually ministers and deputy ministers, when they got together, the things they wanted to talk about was public health.
Where is public health going in the future? I think that's an excellent question, and I don't have my magic ball to actually look into. But I think really people are gradually seeing the importance of public health. Obviously, surveillance is important, and we've had examples like Ebola and other things that we need to really keep on top of. But as the cost of the medical system increases and our technology improves, we have got more and more costs going into the treatment side. So we really need to focus on prevention, and that's something that we can do very well. All these things should be done very collaboratively, and I think that's something that public health physicians are very good at, is collaborating. It's one of the things that we do a lot of, and also communicating and advocating. So I think there is the role is likely to, as costs increase in the healthcare system, there is a place for us, and also for databases. There's a lot of big data coming out. There's lots of research that can be done, and I think on a population level, public health has those skills as well. So I think there's a lot to offer to improve the health of the population. And I've done public health now for 15 years since I took my exam, and I have absolutely no regrets. I love it, and I really enjoy my colleagues as well. I think people have a passion for the health of the population, for advocating for vulnerable and marginalized populations, and it's a good job to be in.
Alors, pour savoir dans quelle direction s'en va la santé publique, en fait, c'est probablement dans la même direction que s'en va le monde. Il y a beaucoup d'inconnus. Mais il y a aussi des éléments qui sont connus. Comme tout ce qui influence le contexte de vie des gens influence la santé, et que le contexte de vie change beaucoup, santé publique a besoin de s'ajuster pour être capable de voir venir les problèmes, d'être capable de convaincre que si on ne fait rien, le problème s'en va de cette direction-là, mais aussi de voir les opportunités. Je crois que c'est un domaine qui va être en évolution constante, et puis plus vous avez de la créativité, plus vous avez envie de voir venir les enjeux, puis d'aider à mettre ensemble des gens pour les résoudre, plus c'est un domaine qui est fait pour vous.
And it seems impossible to say that you can change something that grand scale, but I think of the greats that came before and the changes that they made from everyone smoking or physicians smoking while they're examining you to realizing that that's just not what we should be doing. And they entirely changed the way we live to be healthier.
And I also think we need to not only be showing leadership, but be showing inspiration. And we do see that both public health leaders and public health-minded heroes in the area of public health are really inspiring. And that social mobilization, we know scientifically, is absolutely magic to getting societal change. So that's what we need to be working for.
Une des choses qui est merveilleuse avec la santé publique, c'est qu'on travaille, je dirais presque exclusivement avec des gens qui aiment leur travail, puis qui sont motivés, passionnés. C'est quelque chose qu'on peut retrouver ailleurs, mais qu'on ne trouve pas partout, puis qu'on retrouve définitivement en santé publique, et c'est un gros plus.
My hope is that as medical students come forward going to public health, as public health and preventive medicine residents move forward and have hopefully the opportunity to learn and to ask questions, and to then there's a cadre of well-trained, well-informed, directed people in the public health, then public health will be able to find its way into then making those, in influencing those decisions on healthy public policy, for example, at the various different levels. I think we're going to have to be pragmatic, though, to be honest, because political decisions in terms of where public health is, how people find themselves, chief medical officers, medical officers, health system, it's going to change. And that's certainly true in other countries, certainly true in the UK, for example. It's kept changing over the years. And that'll be the case in provinces and territories as well. Be pragmatic, then decide how you're going to practice, how you're going to achieve what you're going to achieve. I think it'll survive. It has to survive, because I think hopefully there'll be great understanding of what public health is and the influences.
I'm very excited about this generation of physicians that are coming up in the specialty. I think they're there for the right reasons, and I'm very excited with the potential, because there's an awful lot of talent there, and I get to watch now.